Welcome to this important program that we had to put together. And it is not specific to any particular incident, but it's a general sort of a program in which we want to learn from two specialists about how can the community face a crisis that occurs. We have not been trained. We are somewhat hesitant to even ask for help or ask people about how we deal with it at a personal level as well as at the level of the community. So what we did was that after a sort of brainstorming session, we requested a specialist, Dr. Mohammad, who's a psychiatrist, and I will introduce him more formally, and Lisa Ahmed, one of his associates, to come up with a program which will mostly educational and academic. We request that everybody remains mute during the two presentations. Questions can be posted in the chat box. At the end of the presentations, we will be selecting some important questions and give it to the presenters to answer them. We also request that no question should have any sort of personal reference. It should be a general question. If you want more specific information or if you have a question of a personal nature, you are welcome to talk to Dr. Munir and Lisa outside of this program. So the first thing that I want to do is to first thank both of the participants, Dr. Mohammad Munir and Lisa Ahmed, for taking time out of their busy schedules and give us this presentation purely for the sake of Allah subhanahu wa ta'ala. Dr. Munir is well known to many of us since he's very well respected. He has a practice in Central Massachusetts, and moreover, he's related to Brother Mohammad Yousaf as well. So he is from Karachi. He graduated in 1981. He came here and trained in psychiatry with a subspecialty in geriatric psychiatry. He did his residency and fellowship at Boston Medical Center. He served as a faculty at both Harvard Medical School and Boston University. He has been a principal investigator of various clinical trials that deal with behavioral health. Currently, he's the founder and president of Boston Neurobehavioral Associates that produce psychiatric services in Greater Boston and Central Massachusetts. He's also very active socially, has been a regular presenter at various conferences. He has an academic interest as well as clinical interest. So without further ado, Dr. Mohammad Munir.
Assalamu alaikum, everybody, and thank you very much, Tahir and Saleem, arranging this meeting. And as we talked about it, it's important that the community need to get in, need to know how to deal with different crises when we face them. Right. So why we are having this talk? Okay, and as most of folks that we were struggling initially that whether we should do it or not. But some of us we felt that it is important that we should make some kind of arrangement so that the community need to know. So at least we can give them some basic information and the basic understanding how to deal with the crises in the community. So we came up with this idea of having this talk to show the community how to deal with the crisis when they occur. And that crisis can be due to sudden loss of the community members or any other crisis. We are all are human beings. Doesn't matter if we are psychiatrists or we are counselor or we are laborer or something like that. Feelings comes out one way or another. If we don't deal with the feelings appropriately, then feelings get expressed in all kind of different ways. So including sometimes in the form of our physical symptoms. So psychological stress is usually associated with the negative life changes, such as losing a job, losing the loved one, or significant event in the community. However, all changes require some sort of adaptation. So mostly we're going to talk about what we can do and what other resources are available to deal with those kind of difficult situation in our life. Experiencing the significant changes often create the idea that we are not in the control of events. And when those kind of things happen, we feel helpless, sometimes even hopeless, that we wish we could do something to prevent those kind of crises in the community or even in our household. This perception of contribution, this perception contributes to low self-esteem and may even contribute to the development of anxiety, depression, or even anger. As I mentioned earlier, that if we are not coping with those stresses or crisis appropriately, it can impact your day-to-day living. Basically, it can impact the way you deal with your day-to-day stresses. It impacts your interaction with others, including your family, with your coworker, with your friends, and it can also, in some cases, can impact your functional capacity. So overall, the quality of life it get impacted negatively. Not in all cases, but with a significant number of with the cases, right? Coping involves adjusting to unusual demand or stresses. This requires giving a greater effort and using the greater energy than what needed in the daily routine of life. So what does that mean? That we need to pay a kind of special attention if there is a significant stresses in our life to deal with it. It's not the day-to-day living. Those are the special circumstances. The effect of many acute stresses that come may be cumulative and profound. What does that mean? That if we don't deal with it, in some cases, it can have the long-term effect. Not in again all cases, but in even if there's one case, there's one too many. So how do we deal with the stresses, or how we can cope with the day-to-day stresses, especially the significant stresses? Ask others to help or assist you. That can be your family, that can be your friend, that can be your coworker. And in certain extreme cases, if you need to get some professional help, you need to seek professional help. It doesn't mean that you need to take any medications or anything like that. That you need to have place where you can express your feeling appropriately in kind of caring and trusting environment. Maintain emotionally supportive relationship. Okay, that relationship can be with your religious institutes, or can that relationship obviously with a family and other but support need to be there. And try to during those times try to stay away from the negative environment. And you maintain your emotional composure, alternatively expressing the distressing emotion appropriately in the trusting environment where you distance yourself from the sources of from the sources of the stress, that including the media, right? Said that something significant happened in the community, and then we're trying to search through the media what is happening, what is the detail, and all those kind of things. Please stay away from that, and that will create a significant impact on your emotional life. And you can view the problem through a religious perspective. And if you need to ask imam or other religious leader some question and how the religion can, teaching of the religion can help us to deal with it, go for it. Okay, so now I want to introduce Lisa Ahmed. She's a therapist and the part of the community, and she's also aware of our cultural and the religious norm. I worked with her collaboratively, taking care of folks who needs emotional help. And so without further ado, I would like to hand this talk over to Lisa. Lisa, is all yours.
Thank you, Munir.
Thank you, Dr. Munir. Assalamu alaikum, everyone. I am going to share my screen with you. I have a presentation that I'd like to share. My talk is going to focus on coping with crisis in the community, but specifically grief and loss. And as I think as I go through my presentation, you'll find that there are some areas of overlap, because it is very similar. If we're dealing with anxiety, we're dealing with depression, we're dealing with grief, many of the same, messages apply, that, seeking help is not a sign of weakness, that it's sometimes what we need to get us through a difficult time, that there are different ways that these things can manifest, and if they're not attended to, they can harm us. Now, of course, something live may have a little difficulty with the technical stuff. So what is grief? Grief is a normal response that comes from losing someone close to us in the community, or in the community. It can also be other losses, and I want to point that out. This has been a year of many losses, and so it doesn't always have to be a loss of a someone. In my practice, one of the things that I have a lot of people grieving the loss of is new parenthood, and what new parenthood was going to look like. So I just want to give that as an example of the ways that we can all be experiencing loss. When loss is sudden and unexpected, people may experience increased concern for their safety, for themselves, for those close to them, and when they may be unsure of who they can trust, if their neighbors are safe, if the local government will take care of them. I think that's an experience that many people can relate to. When a crisis happens in a community, everyone in that community is impacted. Not everyone is going to be impacted the same way, and not everyone is going to look the exact same way as they're experiencing that loss. What does grief look like? Again, these are some general. People can feel sad or just empty. I just don't have feeling. They can feel numb, which, like I want to cry, I want to be sad, but I just can't. I don't even have the energy to be sad. It can also present itself as anger. And people can be aware that this is not something I should be getting angry about. I should not be losing my temper about this thing. But their ability to control their temper has really been diminished. And again, grieving takes energy, and everything we do in life takes energy. And if my energy is in trying to ignore the grieving, or trying to do it on my own when I really do need some help, it diminishes your ability to do other things that you need to attend to. Your body can be trying to tell you that there's something that you need to take care of, and that can be you can start to have chest pains, or you can start to have stomach aches. I was actually listening to a talk recently by a psychiatrist who said he realized he had anxiety when he was diagnosed with irritable bowel syndrome. So it can take a real toll. This is the classic model of grief by Elizabeth Kubler-Ross. She's kind of the pioneer in this work. And so you have denial, avoidance, confusion, elation, shock, fear, anger, as I talked about, frustration, irritation. You can also have anxiety, depression, overwhelmed, helplessness, hostility, flight, bargaining, and you get to acceptance. So denial, we deny that anything has actually happened. You know, we may go to anger. We have very little tolerance for the people around us. Depression, we can't get ourselves out of bed even sometimes. Bargaining, if I do this, then will this happen? As Dr. Munir talked about, you know, we often try to understand these things through a religious context, you know, trying to understand, why would Allah do this to me? And sometimes we think, oh, maybe Allah is a salesman and I can bargain him and make him, you know, if I do this, you won't do that. This, you know, is not a sign of your lack of faith, but this is about human beings, and that when we're grieving, it's one of the things we do. And then there's acceptance, all right? And that's when we start exploring and trying to understand, what is this new normal we have now that we've had this loss. This is just text explaining this. So I explained to you Elizabeth Kubler-Ross's very nice, very linear model of what grieving looks like. I want to show you this model because it's a bit more of what human behavior is like. You know, we have, you know, numbers here. We say shock and denial is number 1, anger is number 2, depression and detachment is number 3, dialogue and bargaining is 4, acceptance is 5, and returning to a meaningful life is 6. But the reality is that no two people are going to enter exactly in the same way, and they're not going to exit exactly in the same way. So one person might come in with anger and then go to shock and denial, or they might go to depression. They might start off with dialogue and bargaining and then go over to shock and denial. You know, some people, not everyone has to be angry. I also want to point that out. There isn't a, you must feel these emotions because that's the way it works. But these are the emotions that are very common for people to feel as they are trying to deal with grief and loss. How can we help each other? It's important to remember that there's no one right way to cope with grief. Do not judge yourself or others on how you are grieving. Sometimes it's easier to focus on smaller losses than the bigger losses. Give yourself time and space to think, talk, write about the loss. Not everyone needs therapy, but there are grief counselors and support groups available, and it's fine to ask for help with grieving. I want to kind of just expand a little bit on these thoughts. When I say there's no one right way to cope with grief and loss, it's normal to have that period of denial, but if somebody seems to be having a prolonged period of denying that there's been a loss, you know, that's kind of when we need our community to try and reach out to us maybe, and to not judge, but to say, I think maybe we need to talk about this. I think maybe there's something going on here that you're having a hard time looking at, and gently helping. And sometimes we can ask for the people around us to, you know, maybe be our reality check. You know, maybe I'm not doing as fine as I think I am. Also, going back to, sometimes it's easier to focus on the smaller losses. Sometimes it's easier to focus on the fact that we had this small bad thing happen in our life than to focus on the large bad things, because that just feels easier. But if you still do the grief work, that's fine. You don't always have to attack things directly. Sometimes people find it easier to do it a little bit on the side. And I do want to talk about the idea of, you know, talking these things out. We've actually done functional MRIs on the brain, and No offense to medicine, but talking actually is a more effective tool. You have more changes if you talk. So I really want to emphasize talking as a way of helping ourselves to deal with these things. I also want to talk about children specifically. As a parent, it's okay to let your child know that you're grieving, but it's very important that you make sure that your child understands, I'm grieving, but I'm here for you. Your world is still safe. I'm here to take care of you. And I would say, especially parents, because you have double duty, you're grieving the loss and your child is grieving the loss, and you've got to expend the energy to make sure that your child feels safe. I'm going to say, don't feel embarrassed or shy to ask for help, and ask for help in ways that feel good to you. That can be a member of the community, that can be a counselor, that can be a member of clergy, but to ask for that help because you have a very high burden on you as a parent. You need to remember that grief looks different in children. Children are not consistent. They can be one way in the morning, they can be another way in the afternoon, and a completely different way by evening. They don't understand things the same way. They have a harder time understanding what happened. So they may not understand what has happened, why it's happened. And sometimes children are placing meaning on things that an adult would never think that anyone would ever place this meaning on this, this event. It's important to listen to children about recent losses because we need to understand, how do the children understand them? How are they interpreting them? I'm really would say that it's important to listen more than we speak because we need to understand how the child is processing the loss. What do they think has happened? How are they feeling about that? Children also might grieve losses that adults feel are trivial. It's important to remember that children understand things differently. What's important in the life of a child may not seem all that important to an adult. And it might feel safer to acknowledge the small loss. We may have lost a very important member of our family, community, but it's easier to grieve that we lost a dolly than to think about that person. But that's a place to start a conversation with a child about loss and about feelings. And you're helping to train your child to understand how to deal with these things. So it's another skill you're teaching them. Now, I keep on talking about talking, and now I'm going to say to you that talking does not always have to be verbal. There are a variety of ways that we can express our feelings. And for families, I really do recommend family dinners. Sit down, look at each other, talk to each other. How was your day? What's going on? Parents, I'm going to say again that the more you listen, the more you learn, which especially for parents of teens, the car is a wonderful opportunity also for them to talk to you, especially in the teen years. Sometimes they don't like to look at you as they're talking. So we're in the car, everyone's facing front, they're more likely to talk. The less you say, the more they talk, the more you learn about what's going on with them, what's going on inside of their brain, how are they processing things. You can talk to your spouse, a parent, a friend, or a counselor. Journal writing, drawing, and other creative arts are also excellent ways to express your feelings. Play is the first language of children, so play is a way that they're going to be expressing their feelings and creating meaning of what's happened. What I would say is that, don't always, if their drawings seem a little bit dark, start interrogating your child, but just try to understand what's going on with them. What are they saying? Sometimes what they might be acting out is also the opposite of what's happened or what they're thinking, and they're trying to actually change the narrative. They're trying to change history. So again, take the time to listen and to try to understand what's going on with them. Okay, so As I said, sometimes somebody else has to kind of let you know that what's going on with you, because you might be a little bit tuned out or trying to just tell yourself, I'm fine. Sometimes your body will be telling you through stomach aches, nausea, headaches, dizziness, low energy, or lack of focus. If you do go to your primary care physician, which is not, for many people experiencing feelings of grief and loss, share with your doctor. Remember that this is a private setting, and share with your doctor what's going on so they can help direct you to the appropriate resources. Share with your friends and family what's going on. Sometimes it can be very helpful for people to say, oh, I'm really feeling badly, for another person to say, I am too, and let's share our grief. It also helps to get a little insight, maybe get some support. These things take energy, and support is very important. So don't be afraid to ask for that support. All right. These are a couple of resources that I found. It's hardly exhaustive, but Jeff's Place is family focused. It's in Framingham. So that's the website for that, and it's an individual agency. The Seven Hills Foundation affiliate, people might be familiar with it. They actually are an affiliation of several agencies in the central Massachusetts area. They have a program that people can also volunteer if you're feeling like, well, I'm handling this pretty well. I've gone through this experience. I want to give back. They do actually have an opportunity for people to volunteer, but they also provide grief counseling to families that have experienced a loss free of charge. So I do want to point that out there. There are some other services that I found out there, but not all of them are, I would say, all that affordable. So I was looking for things that a person could afford long term. So that's my presentation. If there's something that people would like just a little bit more clarification about, please let me know. I'd be more than happy to expand the thought.
Thank you so much, Lisa. Your presentation is very important, and it has actually made a lot of people think and ask more questions. So be prepared for the question. The first question that I have coming from Asia is that when you are comforting or speaking with someone who is grieving or going through a tough time, it's not easy for us to determine where the dividing line is between getting professional help or looking for comfort from the friends, and how and when should you recommend someone speaks to a professional?
So I know it's tricky to know where's that line. I think that as a friend, one of the things you have to say is, do I feel that I have any knowledge or skill to share with my friend? Sometimes when your own self, you're trying to comfort your friend and you're feeling like, I don't know if I'm the right person for you. I think it's also important to be honest with people. I don't know if I have the skills and the knowledge. I can be here, I can be empathetic, but I don't know if I have the skills to help you feel better. I think also for an individual to think about, how is this impacting my life? Is this, I'm just tearful and sad, but I've had this loss. It makes sense to be tearful and sad. Yeah, but I also didn't get out of bed 3 days in a row, and I haven't bathed in a week, and I've lost 10 pounds. This is definitely having a negative impact on me. I need to seek out some professional help because I'm not doing well. It's having an impact on my life. I also say to people, because I frequently get people in my office will say, I don't know if I really should be here. I think people have worse problems than me. I don't know if I belong here. There's never really a bad time to seek out counseling. If you think, maybe it might be nice to talk to somebody, then call. I think that it's never wrong. Remember that you can call to see a counselor and to talk to us. We're not, our role is to talk to people how they're feeling. It's not about, evaluating and saying whether or not you need medication, right? That's a very different thing. There's people that medication is appropriate for, and there are people that medication is not appropriate for. So if you feel like you need to talk to somebody, then pick up the phone and call. That's, I would say. And as friends, if you see that somebody is not doing well, then recommend that they see somebody. If they're tearful, that's one thing. If they're not bathing, they're not eating, they're not attending to their life, that's a serious issue. And I don't know if people are like, in the middle, I'm confused where that line is. I would say everything, if you're just a little tearful, still feel free to call and reach out to a therapist. Okay.
Thank you, Lisa. Now, as a corollary to the same question, how far should you respect someone's privacy when you sense that they are at a stage where they may harm themselves or harm others? The question is for both of you, both for you and for Munir.
Okay, so what I would say is what I let everybody know is that the law is very specific about what I can and cannot do with information. And the one place the law says I have to break that bond of confidentiality and I have to seek out additional help is when somebody is going to harm themselves. Harm is the thing that we can never, ever, be lax about. If there is a fear for somebody's safety, then reach out and get those services because we cannot take that chance. So that's my very hard line. Dr. Munir may have a different line, but that's where I would recommend.
Yeah, I agree with Lisa, and that there is a clear understanding as far as the law in Massachusetts is concerned, and also in different way in some other states. If we feel that the patient can harm himself or others, or even if they feel that because patient's or person's judgment is so much impaired that not making the appropriate decision in their life, and because of this patient's inability to make the good decision, they can end up hurting themselves or property or even or others, then that is very clear that obviously if the person, for example, does not have any therapist or any psychiatrist in place, I think that it's okay to call 911. Okay, and what happened, there is a law, there is a section, we call it the section 12. Section 12 is basically involuntary evaluation by the professionals. It doesn't mean that patient will need to be admitted to the hospital, but emergency services and sometimes the police get also involved. They take the person to emergency room for evaluation, and then the professional in ER can evaluate the patient and make the decision whether the patient need to be admitted or not. And it can be done by any person, okay, and especially any physician or police officer or therapist and things like that. But we need to take this threat very seriously, okay. And if even if the person, there's a person feel that no, but patient is expressing that I wish I was not alive. Okay, it doesn't mean that patient wants to hurt himself or herself, and then you encourage the person to get some emergency help. The way you get it, that in all communities, including the Worcester community or Framingham and all those kind, they have the crisis center, right? In the crisis centers, it's not that they're hospitalization, but it's better than the emergency room because you don't need to wait too long, and someone will see the person and make the appropriate appropriate plan, what to do. So this is important, and also that the community, especially the leadership in the community, need to have some telephone numbers or contact information about the crisis services in the area.
Thank you, Melinda. Go ahead.
Go ahead. Yeah. No.
Okay. The next question pertains to us living as a very tightly knit community with very specific cultural traditions and religious ideas. Good news may not spread, but bad news spreads very fast.
Right.
So if something has happened in the community, should we be talking openly about it, or should we not? Because otherwise it will lead to rumors spreading very fast, people getting some misinformation. How far should we discuss, and how far should we try to withhold ourselves?
Go ahead, Lisa.
Okay. So I guess what I always think about whenever we're discussing anything is, what is our intention when we discuss this? Are we discussing this because we're trying to make sense of something? And so we're having a discussion to try to say, why does this thing happen? What happened? Maybe we had some sort of tragedy and people are thinking, why didn't I see what happened? Why wasn't I aware that this bad thing was about to happen? Why didn't we prevent it? So if we're having a discussion because we want to try and prevent something like this happening in the future, we're trying to help the community, then that's a discussion that has a good intention. We're doing it because we want to help our community. We want to make our community better. We want to help people. If we're discussing it because people are grieving, because we say, this bad thing happened to this person and this person was important to me and I'm grieving, then our intention is to share our grief. And that's fine, that we're sharing our grief. And that as a community, if we're coming together to share our grief, to share our sorrows, if we're coming together as a community because we want to be stronger, because we want to say this bad thing happened and we don't want that to ever happen again, then that's fine. But then if we're just talking because we're talking, because I know something happened and I don't know the whole story and I want to know the whole story, then I think it's on us as community members to say, I'm not quite sure we need to discuss that. Because that's when we get into maybe we don't have all the facts, we start, putting some things on it. One of the things about we human beings is we like to have a complete picture. And when we don't have the complete picture, we have a tendency to put in some information to make the picture full. And often that information we put there is not truthful information. It just could be, but frequently isn't. So what I would say is, if we're just talking because we want to know what happened, then we should censor ourselves to say, that's not helpful. That's not good for the community. That's not good for us. If we have intention to grieve together or to help the community, then we can talk.
Anything to add, Dr. Munir?
Yeah, I agree. I mean, there's no need to be very clear about it. We need to be the person who is trying to get a bit more information. We need to be very clear about it. I think this kind of meeting, what we are doing it is important. Okay, because it is important. We learn something. Also, the community learns something. Because when we try to avoid those difficult subjects, that's bring other rumors, and then in those kind of meetings, we also try to educate the community. So how to deal with those kind of situations. One of the things that, as I mentioned earlier, if they can avoid this, searching the news and go on Google or something like that, that's going to be helpful. But yes, if they want to talk about how to manage it. Okay, if they have any question about their relatives, or they have a question about their children, or yes, this is think that we need to get involved, but speculating on any the particular subject, if we can avoid that is basically advisable.
The next question pertains to religion. We are all very religious people. And instead of going to a psychiatrist or a professional, a person may prefer to go to a religious person like the imam of a masjid. And are our imams really trained to direct them to a professional, or should everybody be educated that yes, religion is important, but religion can help. At the same time, sometimes professional is better suited to deal with that issue. So how do you deal with that situation in educating the religious people as well as educating the people that they should not only consult a religious person for consolation, but they should also seek professional advice?
I'm going to have Lisa talk later about it. One of the things is that we need to provide space, right, for the folks. If they want to talk about it, they should be able to talk about it. I think with those kind of circumstances, not necessarily the crises, but in a household, a lot of things can happen. There must, if we can train few people in our community to be there just to listen, just to listen, and because that person who is talking to you, they know their circumstances a lot much better than us, than any professional. Okay, but if we are there to listen to them, just keep listening to them as much as possible. Okay, and then if we need to intervene a little bit here and there to get more clarification, we should do that. But we need to provide an environment where we can provide the community this resource. If they want to talk to somebody, at least somebody is there. And then that person, if they feel that really they need further help for that, so that they can try to talk to the person and seek professional help. Lisa?
Yeah, so I think I agree with what Dr. Munir said. I would say that also one of the things that as a community we can think about, I think there's multiple layers of what we can do in terms of creating space for listening, being aware of the resources that are out there. Dr. Munir and I both receive a good number of patients because people find out that we're Muslim providers and they want to go to somebody who understands where they're coming from. I get a lot of patients who maybe want somebody who is biracial, somebody who is of the same faith as them, because it feels that you can connect and this person will understand you better. So I think knowing who are the providers in the area that might help a patient, to give it a non, in terms of mental health clinical, a friend of mine who was an Arab speaker appreciated being able to go to a dentist who is an Arab speaker. We want somebody who we feel like they can understand us. But I think also as a community, we can think about some of the things that other communities are doing. In the Christian community, they train members of their community to be, they call them lay counselors. So they are religious people, but they give them some basic training in counseling to help them to understand, so that that might be a good starting place for many people. And many people may not go beyond that. They may have, situations that they can address in that setting, with a lay counselor who has minimal training to help them. But that lay counselor could also be somebody who helps them say, you know what, this is a serious issue. You really need somebody who has studied more than myself and understands better than myself how to help you. So if as a community, we wanted to make that commitment, I think that that's certainly something that we could benefit from.
Yeah, so if I can add one more thing, that as a community as a whole, that we need to start thinking about how do we feel about mental health services, or how do we feel about the behavioral medicine, or how do we feel about the psychiatry? Okay, and as we know, it's not only in our community, but this is a universal problem. There's a stigma attached to it, right? There's a stigma attached to it. You know, if you're going to see a therapist or you're going to see a psychiatrist, you must be crazy, right? Or and because of that stigma, there is a significant numbers of the folks that don't get proper help. Okay.
No, I agree
And
with you, Dr. Munir, and the same actually applies to marital issues. That
yes.
people will rather go to an imam than go to a marital counselor to resolve their issues. And our
Mhm.
imam has actually recently told me that he stopped doing marital counseling because he does not have the expertise to deal with these things. He knows his own limits. But when
Mhm.
it comes to like mental health issues or grief issues, when people go to a religious person, I think a very precious time may be lost in just giving them religious advice when they are at the brink of falling off the cliff. So I think
Mhm.
that realization by the religious leaders is also very important when they should, what are the red flags that they should pick up right away and direct a person to professional help rather than just giving religious help. So I think that we may probably need to talk about it separately, or what kind of services we can put in place that when a
Mhm.
family has suffered such a loss, even if they're not showing any overt signs of grief or anger or
Mhm.
other, we should be able to offer them some help or direct them to a professional. The next question is related to the
One thing,
tuberose.
I
Uh,
want to add one thing, so please. I think one of the things that's also important when we talk about mental health is to focus on the health part and less on the mental part of that. And what I mean by that is understand, and hopefully one day it will happen, that we are part of the healthcare system. We, just like, your cardiologist and your pediatrician, we are taking care of your health. And so if people would just, I think part of like how do we help deal with the stigma is reminding people we're your healthcare providers. Okay. And there's something wrong with your health. So that's the message I would like to I hope people leave with.
That's a very powerful message, Lisa. Thank you. Now, the next question is related to the Kubler-Ross five-stage grief cycle. And one person probably read my mind, is
Mhm.
that how do you determine at what stage of that grief cycle is a particular individual at? And sometimes is it possible that the religious helps them overcome it, that from the moment of grief, they go to the phase of acceptance without going through any other phase?
No. What I say to people, um, you know, Allah can help you go through and be, that partner and help you give some of that energy, and your faith can give you energy to deal with this. But you have to go through the stages. You can't have significant loss and be like, okay, I'm going off to work now and I'll be well. It doesn't work like that. We have to go through the stages. We have to experience it. And if you just try to suppress it, as Dr. Munir pointed out, it's going to show up in other places. You're going to have health issues. You're going to have, maybe you're not going to focus as well as you should. Maybe you never get angry at anybody, but you're not paying the same attention to your work as you normally would, or your studies. So there's going to be a consequence. There will be something. And then also what can happen is something else will happen in your life and you'll just fall apart, and nobody will understand why you just fell apart at this very insignificant thing that happened. But it's because the wall that you've put up has broken, and now all those emotions that you've been trying to ignore are just going to flood you.
Thank you, Lisa. Now, there is a comment rather than a question that we should make sure that all of our mosque and religious leaders have access to reaching out to the therapist. That is a list of behavioral specialists in the area and their contact info. So I think this is a very important that every masjid, or at least the leaders of the masjid, should have a list of who to reach out when such a tragedy happens. Now, following up on what you mentioned, Lisa, that everybody actually goes through these cycles, whether are willing to accept it or not, they do go through that. And I can tell you from my personal experience, When my mother passed away, I actually didn't even cry. And again, my feeling was that if I show weakness, my family will be affected. And within a few months, I started having chest pain and had to go through heart catheterization and all of those. What I was suppressing was coming out in the form of physical symptoms, which were actually not physical. But when my father passed away, I cried as loudly as I could. And I told my family, just let me cry. Let me let it out. So I kind of agree with you, knowing from personal experience that people go through this cycle. Now, one thing that wasn't mentioned in that 5-stage cycle is the blaming. That you start blaming yourself or you start blaming somebody else, and families start blaming each other, which can actually lead to split and rift in the family. And if the community senses that this is happening, what is the community's responsibility?
Okay, so yes, so the blaming, I think blaming can happen when you're in the anger stage. The blaming can happen when you're in the bargaining, like, oh, it's because I did this, or I don't do this. You know, somebody could say, you know what, I don't pray 5 times a day, and now this bad thing has happened. I promise, you know, I'll pray 5 times a day. Please just, you know, make this bad thing go away. You know, or this person did that thing or whatever. And, you know, so one, I think if we can try to approach each other, like if somebody is giving us a lot of blame and anger, sometimes it helps to take a step back, take a deep breath, and to kind of say, oh, you're having a whole lot of feeling here. Can we maybe discuss why you're having so much feeling, why there's so much going on here? I'm not really understanding why you're blaming me for this thing or you're blaming this other person for this. Sometimes as a community, we need to not be quite so reactive, and we need to kind of allow space for people to maybe, I guess kind of like what I was saying with the teenagers, if you're more quiet, then they do more speaking and then you get more information. You know, I know every parent has probably sat down at dinner with a teenager. How was your day? Fine. And you're waiting. What made it fine? What happened? If you ask them a different question in terms of, oh, what did they serve in the cafeteria for lunch today? Was it anything you could eat? You might get more about what happens in the cafeteria and what's happening in the social scene. You might also find out that they haven't been sitting with their best friend for the last 3 weeks because they're withdrawing socially. And now you have some understanding about what your child is going through and that there's something you need to address. So sometimes if we ask different questions, sometimes if we don't always respond, if somebody's blaming us or mad at us for something with a defense and an anger, then we open a place for them to let out emotions that they weren't even aware that they were concealing. So I don't know if that's helpful to answer your question.
Yeah, right. Now, what about visiting a family in crisis? You know, sometimes we feel reserved that we might be treating on somebody's privacy, when in fact they are looking forward that somebody would come and talk to them, but they are also not, they're kind of embarrassed to ask for help. So what should you do in this situation? Should you call them?
So I guess I would say it depends on the relationship that you have with them. I mean, are you at that level? I feel that we should at some level treat and respect the relationship we have with people and not do something that is unusual for the relationship we have. If I am not on the, I can just show up at your front door without an invitation level, I should not do that then. You know, now I'm intruding because we don't have that level of connection. But if I am at that level where I can just show up and say, hey, I was in the neighborhood, I thought I would just stop in, then fine, I'm respecting the relationship we have. You know, the big thing is to respect what is the relationship before the tragedy and then continue to practice that way. And if you feel like you're not that level of person that could show up at their door uninvited and they are kind of pushing people saying, no, 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 we're fine, then reach out to somebody you feel is at that level and say, you know, I know they said they're fine and they said, no, not to bother to come by, but I feel like maybe somebody should stop by. Maybe you could stop by.
So I guess what I was trying to think was that maybe we should be designating 1 or 2 individuals in the community who could communicate to a family or an individual in need that the community is behind you. And if you want to talk to somebody, if you need any help, we can provide, rather than everyone calling them 10 times a day and finding out the same thing.
Right. I think that if the community organized it from the point of view of there being a point person for that family, that would be probably helpful for families to feel like people care, but they're not going to harass them. Yeah, that would probably work.
I mean, intention, everybody has good intention. Everybody wants to help out. But again, it may be impractical for a family to deal with 100 people knocking at the door, as you mentioned. Any other questions, any other comments? We can even open up the dialogue if people want to speak to Lisa and Dr. Munir. Just a dialogue, we can do that. You can unmute yourself if you want to and ask questions directly or just comments without, again, talking about any specific incident.
Assalamu alaikum, this is Asia. I just wanted to say that was a really great presentation, and I think it is a good idea for the community to look into kind of getting its own mental health counselor, as both the doctors said. So really great discussion. Thank you.
Thank you, Asia.
This is Brother Yousaf. Can you listen to me?